All righty. Okay, here we go. In 3, 2, and 1. Breast cancer. We're going to start that over. 3, 2, and 1. October is Breast Cancer Awareness Month, and today we're joined by Dr. Joyce Feagin, an oncologist with Willis-Knighton Health, to talk about a topic that affects many families. We're talking about breast cancer in African American women in particular. And while breast cancer does not occur more frequently in the African American community compared with other groups, studies do show that they are more likely to be diagnosed at a later stage, which can make treatment challenging and the outcome very different. Dr. Feagin, help us understand why there is a big difference. First of all, thank you so much for taking the time to educate us on this matter. The mortality rate, though, 40% higher?
Yes.
In the African, let's talk a little bit more about that in the whys.
I mean, it's multifactorial. You know, some of it is genetics. Unfortunately, there are very few African American women enrolled on clinical trials, and that actually tells us the best way to treat people. You know, some of the studies have shown that some patients respond and some ethnicities respond a little bit differently than others. So we're basically extrapolating data to this group of women and men also that hasn't been proven.
But the late diagnosis is also a big factor too, I would imagine.
Oh yes, absolutely. You know, a lot of it is racial bias, socioeconomic levels, all of the things. When you look at people who are being screened head to head, the screening rates are similar. But somewhere down the line, there's a bit of a disconnect. After you've been screened, after you've been diagnosed, is your care the same? Are you getting to the doctors that you need to get to as soon as possible? Or do you have the proper insurance that affords you the best care? All of the things.
Major factors. What about the symptoms? Are they the same?
Oh yes. I mean, typically it's a lump that is discovered on palpation, either accidental or on monthly breast self-exams or by screening mammograms. But anytime there are changes in the skin, changes in the nipple, changes in the texture of the breast, those are things. Leakage from the nipple, all of those things are similar. Now, one difference that you might say is whereas somebody's nipple who is lighter might turn red, a darker person might appear purple or a little bit darker. But other than that, the symptoms are the same.
As you're speaking, I'm thinking about conversations that we may or may not have in our homes around the kitchen table,
right.
And the importance of having a screening done.
Yes.
Is
yes.
that a part of the problem too? We're just not getting the screening?
No, the screenings are happening. You know, you can get a mammogram.
Yeah.
There are actually grants that support screening, but what happens after?
Right.
What if you don't have insurance?
Yeah.
What if your Affordable Care Insurance appointment is 6 months out? You know, those are the things that actually matter.
What about genetics? Genetic testing, could that reveal that a woman, an African American woman, is at a higher risk?
Not just African American women, any women. If you have a first degree relative that's a mother, sister, brother, father with breast cancer and they have had genetic testing and are positive, or even if they are negative or have maybe an ovarian cancer, those are cues that you might be at increased risk. And there are programs, there are screenings that you can do to evaluate your risk so you can make better decisions about what to do next.
When you go home at night, Dr. Feagin, what is the one thing you say if African American women would just do this one thing, what would that be?
Be their own advocate and talk more. Maybe some of our conversations need to be different. Maybe we need to talk more about health screenings and getting healthier, and maybe less about superficialities.
Right, because you can be treated successfully.
Yes.
And live a very long life.
Absolutely. Early detection is key.
Dr. Feagin, thank you so much for joining us.
Absolutely.